Take care of me. Talk all day, then at night, falling deep. Stimulate me. I want you mental and physically.
Hi guys, welcome back to my channel. My name is Dijah Alize. If you're new here, if you're not, welcome back once again. So today I'm opening up another vlog. It's been a little crazy so far. I just wanted to give you guys an update of how nursing school is going for me. But before we get into that and before we get into this video, don't forget to please like, comment, and subscribe and stay tuned. Okay. So, I know I said I would be vlogging a lot more this quarter, but this quarter has been crazy. Like, so far I have had 3 exams. It's only week 6. I've had 3 exams. I have 2 ATIs coming up. I have 3 more exams coming up. And then a few weeks after that, I'll have another 3 exams. So if you guys don't know what ATI is, it's basically, I've explained it before, but basically it's like a supplemental type of thing that they give you in nursing school. Basically, it's supposed to help you further your knowledge and expand on, whatever. And then it's also, I guess, supposed to make sure that you're meeting like national averages and not just like your school curriculum. So apparently maybe it's supposed to help you with the NCLEX. I don't know. But all schools either use like Kaplan, ATI, or HESI. It just depends where you are. But basically that's what they do. So yeah, I've been very stressed out this quarter, just to be completely honest. I've been very stressed out and it's been a journey so far. Like, I thought having like in-person clinicals would make things a lot better, but like it does because it helps me learn, but also at the same time, it takes away from time that I need to like read and get ahead and do my assignments and all of that, because it's mostly reading that I need to do. And that's kind of like where I'm barely staying afloat. All my grades are great right now, but it's just like, it's very hard to just stay afloat. And I'm a person that likes to be ahead of my work. And right now I'm just on time. So I'm struggling with that and trying to get ahead, because I do have something very big planned next week, which I'll take you guys with me, so we can go to that. Also, I was supposed to have another simulation last week, because right now it's week 6. Last week was week 5. I did not vlog last week. Basically, I got an email from my school saying that we had all been exposed on our clinical day, that I got a few clips on for you guys in the last vlog. Basically, we were all exposed and we had to quarantine for 14 days, meaning we could not come on campus until this week, this Thursday, which I mean falls like right in line, because we're supposed to be going to the hospital this Thursday for clinicals, like our on-site location. So I'm just hoping like they still let us this week, because last week we had to do it online and I hated it. Like, it's just so hard to stay focused while you're online. I've already had a class today. I had med surg this morning, and now I'm going, well, not now, but I'm doing an assignment until it's time for my mental health class, which is around 12 and ends at like 2. So yeah, I just wanted to give you guys an update. This quarter is by far the hardest that I've been into. Like, when they said like it was the hardest quarter, I understand, because now I see it. It's been a challenge. So right now you guys will see me like, I don't know if I'm gonna film this, but basically I'm doing a discussion right now and I'm watching YouTube videos to pass the time. So yeah. But I'm gonna try to like get more content in this week, because I know I don't like film a lot, and I don't film like my all day activities. I really just, do my nursing stuff. but I'm gonna try to get more into like the lifestyle aspect. So giving you guys more of my everyday life as a nursing student and not just the nursing school work. I'm gonna try to give you guys more starting now. So yeah. Um so that's why you guys have been getting videos kind of spread out, because I'm trying to stay afloat with work, and it's like I have time to film, but I don't have time to edit. So yeah. So I'm not sure when you guys will see this. Hopefully you guys will see this like next week and it'll all be fine. But yeah, I just wanted to give you guys an update on that. Good morning, guys. Today is Tuesday. As you guys can see, I'm just now getting my day started. I'm in the kitchen. So basically today I'm getting a late start. Like it's 11 a.m. I never wake up this late, but I woke up earlier, and then I tried to do that thing where you go back to sleep, but then you sleep too long. So that's what I did. I'm about to get my day started now and basically make me some breakfast and get my day started. Tuesdays are pretty chill days for me. Like I really don't do much besides work out, probably do some pharmacology work, or if I haven't finished my med surg work, I get that done. But today is just gonna be like a pharmacology day. So have to get that done. I'm gonna try to get some breakfast, get some tea probably to get some energy, and then do my pharmacology work all day, which is drug cards. I'll show you guys that, and then I'm gonna try to get ahead on some work for next week, since I do have something planned, and I don't want like schoolwork to be in the back of my mind while I'm trying to have a nice time, you know? So yeah. So this is how I do my drug cards. Basically, this is a good example of one. I'm not done with them. I'm just showing you the ones I have so far. So basically, this is the generic name. This is the brand name. This is the drug class. These are the other drugs in the drug class. And this is the mechanism of action. And this is the indication. So basically the indication just means like, why would you use this? Use it for patients with hypercholesteremia. So then if you go to the back, you have the therapeutic uses, which is basically what the medication does and for who it does it for. Then you have the adverse effects. So this is basically all side effects. And if it's like life-threatening or something, I'll just put a star by it. But these are just the ones that I've seen for right now. And then also you have the patient teaching. I usually add more to this, so I'll go through like my drug book and go add more to this. But this is just what I got from my textbook so far. And these are the nursing considerations. So these are just things you need to look for, assess, evaluate, all of that as a nurse. So a lot of times these things will come up on tests. All of these things will come up on tests. And basically what our teacher does is she wants us to know all of these things. And so this is why these are the only things I put on the drug cards, because there's other things to know about drugs, but this is what she wants us to know. So yeah. So basically what will happen is our teachers want us to know basically like a prototype drug, which is like the one main drug that represents all the other drugs in the class. So for example, I was showing you guys lovastatin, and there's a lot of statin drugs. They all end in statin. So like atorvastatin, simvastatin, rosuvastatin. The names are hard to say, but basically all the statin drugs pretty much have like the same side effects and the same things that they do, same mechanism of action. So that's why she gives us like this one drug, and then basically we do a card on that and we can tell what the other drugs in the class do, which is why I put the names on the top. So that way, if I see those drugs, okay, I think, okay, what does lovastatin do? So that helps me. And I do pretty well in pharmacology, surprisingly, because I didn't think I would. But like my last exam, I got a 94 on. And that was the first exam. You know, you really don't know what to expect in the first exam. And I got a 94. So I'm hoping to do the same on this next one next week. Another study tip I can give you guys for pharmacology, well, all my classes really, is use Picmonic. I use Picmonic. Some people use like the Kathy Parks cards for all the different subjects. I choose Picmonic because like the pictures, the stories, the little, things that help you remember everything. If you've seen Picmonic, it helps. Picmonic, they do have like free lectures and stuff on YouTube, but they also like have a website that you have to pay for each month that basically will you know, let you like see everything, and you just pay like $10 a month, which I do. But like it helps me a lot, so I don't mind paying it. And yeah, so that's just some free game I can give you guys, and that helps me with pharmacology, because if not, pharmacology would be really, really hard. And I use the same thing for med search. Only class I really don't use it for is my online class, and for mental health. But for mental health, I mostly just use ATI, like the practice quizzes on there, because it's like really the same as our textbook. So, it's exactly the same. So I don't need to do too much. But yeah, so that's just some study tips for you guys. And also, like, if you want to use like my prototype with the drug cards, it's not too much. Like, I'm not drawing pictures and stuff like that, because I can't draw. Like, I can barely draw straight squares, as you guys can see. So yeah. Hi guys, so today is Friday. I just wanted to give you guys an update. Yesterday was Thursday. I really did not vlog yesterday because I was in clinical all day for 12 hours. And that clinical was not the best experience, but I'm not going to talk about that today, because most of my clinicals are great experiences. It's just yesterday was not it. I just wasn't placed with like the best nurse for learning, to put it in the nicest way possible. And that happens sometimes. So I really was just with my instructor for most of the day, and she was my nurse. So, but yesterday, me and my fiance kind of came into the realization that I kind of want to work as a tech to get more experience. And with the way, things are going with the pandemic in Florida, I don't know if we'll be like in the hospital for clinicals much longer. So it's a little rough right now. But yeah, so last night I applied to some PRN student nurse apprentice positions, because down here the nurse residency program, well, one of the really big ones that everyone wants to join, has a student nurse apprentice program, where basically they're kind of training you to work in their facility, but also you're working as a tech and getting that experience. And then basically what you do is like you do all the tech work while still getting that exposure, and then you get priority consideration into their nurse residency program. So, I was just kind of thinking about it at clinical, and then I spoke to him about it last night, and we talked about it, and we decided that it probably would be best for me to do that. So, I did that, and good news is that I got contacted this morning, actually, through email and by phone. Email was just to fill out this assessment and send in my transcript saying that I finished my foundations and fundamentals course, which I already have last quarter, as you guys know. And then also to schedule an appointment with the hospital, like a telephone interview, because they're not really doing in-person things right now, and understandably why, down here. So I have a telephone interview on Tuesday coming up this week. So I'm so excited about it. And it's at the hospital I wanted it to be at. Like, that's the hospital I want to work at after I graduate. So to have this position at this hospital would be great. So praying that I get it. Hopefully in the next vlog, I'll have good news for you guys that I did get it. But, speak it into existence. But I just wanted to give you guys an update, because I know I haven't really been vlogging very much this week. Right now I'm working on my work for next week, so I can get it out of the way, because I told you guys I have plans. So yeah, I'm gonna get this work out of the way and so I can be free from my plans next week. So yeah, I'm getting this out the way and I will check in with you guys later.
Hey girl, hey girl, what this make you feel like though? What this make you feel like though? What this make you feel like though? Girl, come wine till you broke off your back, broke off your back, broke off your, broke off your, broke off your back, if you broke off your back, broke off your back, broke off your, broke off your, broke off your back. Girl, you know you got the glue, know you got the glue, know you got the glue. Come broke off your back, broke off your back, broke off your, broke off your, broke off your back, girl. Who you are wrong with? I know game. Anytime you're ready, girl. Come in here. The face make you fly. In the rain, it make you feel high like on a plane. She said I saw the love, the act. Baseline sweet and I touch this fat. Dancing, she love you that. Girl, go to the track. Come wine till you broke off your back, broke off your back, broke off your, broke off your, broke off your back. If you broke off your back, broke off your back, broke off your, broke off your, broke off your back. Girl, you know you got the glue, know you got the glue, know you got the glue. Come broke off your back, broke off your back, broke off your, broke off your, broke off your back, girl. Girl, your body hotter than a suntan. You make me turn up at attention. You pretty like the melodies in a me song. Plus the cookie know your body you make your body strong. Girl, any problem you got now with a fix it. And when you dance to me song, it turn addictive. Up like a drum on a beat, it you tight like a secret. So you feel wine till you broke off your back, broke off your back, broke off your, broke off your, broke off your back. If you broke off your back, broke off your back, broke off your, broke off your, broke off your back. Girl, you know you got the glue, know you got the glue, know you got the glue. Come broke off your back, broke off your back, broke off your, broke off your, broke off your back, girl. Why this make you feel like it?